Right now on 10 News at 5:30, May is Mental Health Awareness Month, and we're breaking down some stigmas tied to mental illness in Tennessee. Tonight, we'll hear from experts about the challenges they are hoping to address.
People are having more of awareness that mental health care is not separate from overall health.
Plus, we will tell you about the resources and the holes in mental health care here in our area.
Here in Knoxville, I don't think it's a lack of diversity, I think it's lack of opportunity.
Then the latest in legislation fighting the mental illness epidemic here in America.
They're not out to do evil in that way. I don't think they're doing it on purpose, but they are aware of what's going on and they know the extent of it, and they really do need to fix it.
Tonight in our special, we are digging into mental health here in East Tennessee.
Ten News on WBIR starts now.
Good evening, everyone, and thanks so much for watching. I'm Shay Smith. Children in Tennessee are struggling with mental illness more than ever before. This comes from the most recent State of the Child report. It shows a trend in mental health decline for kids between the ages of 12 and 17, and professionals call the suicide rates alarming.
We have more suicides in Tennessee than the national average. For young adults and adolescents and children.
Experts point to bullying as a key problem. A third of children across Tennessee say they've been bullied, according to that report. Now, experts say most of the bullying is online. They say cyberbullying is more common because it makes it easier for bullies to reach their intended target. Now, this is a trend we are seeing across the nation, and some families are taking legal action against the platforms that they say allow this behavior to go unchecked. Right now, tech giant Meta is facing more than 1,000 lawsuits. People argue the social media platforms run by Meta are intentionally designed to cause social media addiction and harm children's mental health. In New Mexico, Meta was found liable for endangering children and misleading the public.
Real age verification is what allows the platform to curate a different type of experience for young people and make sure they're safer online.
New Mexico's Attorney General is asking for a sweeping list of changes he says are related to alleged psychological harm, including limits on addictive design features, algorithm recommendation changes, and improvements to age verification. The Dolly Parton Children's Hospital is working towards making sure kids get care for all their needs, including mental health. Emily Crabtree spoke with the hospital's psychology department to learn more.
When it comes to taking care of patients, the Dolly Parton Children's Hospital wants to make sure they're taking care of the whole child.
We've strategically integrated licensed behavioral health providers, so psychologists and other licensed behavioral health providers into our primary care settings.
They say mental health is just as important as physical health.
We're really trying to address, it's holistic care, right? In a sense of we're trying to address as much of the medical and behavioral problems and issues in the same setting as possible for families.
And right now, they're seeing some alarming trends.
We're seeing children at younger ages meeting diagnostic criteria for anxiety and depression. If you look at the CDC data from 2021, nearly 1 in 5 children ages 3 to 17, so about 21% had been diagnosed with a mental, emotional, or behavioral health condition.
They say there are a lot of factors that go into poor mental health, but a big one is social media use.
I think a big one that I see and I'm really passionate about is excessive screen time, social media, and YouTube use. We really see that, that's one of the, maybe not the only factor, but it really contributes to poor mental health.
She says it's important for parents to look out for any emotional or behavioral changes in their children and to be a listening ear if they need it.
Listening to their children's feelings and just validating those emotions, even when we don't fully understand them. I think it's even more critical when we don't understand is that, hey, I understand you're feeling this way. And that's okay.
Millions of mothers also face struggles, whether it be during pregnancy or postpartum. For a decade after having her first child, Wendy Davis says she faced depression and anxiety. She says she couldn't eat or sleep. 1 in 5 women face similar symptoms of mental health disorders during pregnancy and the first year after giving birth. But despite its prevalence, experts say many are unaware that these symptoms are temporary and easily treated.
I was so embarrassed, and I didn't tell anybody, because depression changes how you think about yourself. So instead of thinking, I need to reach out and let somebody know, I thought, I can't tell anybody. It's important to know you're not alone. It's not your fault, and with help, you will be well.
Now, Davis's struggles were over 30 years ago, and now she is president and CEO of Postpartum Support International. It's a nonprofit that provides free resources and support for those who have symptoms she struggled with herself. And there are specific resources to help mothers and all women struggling with their mental health. The National Maternal Mental Health Hotline is free and confidential, and it's support for women before, during, and after their pregnancies. That number is right there on your screen. You can call or you can text it now and talk to a professional. Well, coming up next, a new way to treat mental health struggles for Americans is now heading to the FDA. The benefits and the questions scientists are still asking. Coming up.
10 News on WBIR starts now.
Welcome back. Drugs once considered off limits or even dangerous may soon become legitimate in mental health treatment. The FDA is fast tracking the review of some psychedelic-based medicines following a recent executive order from President Donald Trump. Ivan Rodriguez has more on what this means for patients and the questions that still remain.
The Food and Drug Administration issued national priority vouchers to 3 companies studying psychedelic-based medicines: psilocybin, the active ingredient in magic mushrooms for treatment-resistant depression and major depressive disorder, and methadone, a drug similar to MDMA for post-traumatic stress disorder.
Psychedelics really are a paradigm changer. And potentially, I think we don't yet know how much, but there really seems to be a unique way that they have of working, that 1 or 2 doses can cause rapid relief of symptoms within a couple of days, and that for many people that relief seems to last for weeks or months.
But the path forward isn't without concern. Dr. Hellerstein wonders what will happen once these drugs move from tightly controlled studies into real-world use.
The studies that are done for FDA approval, they really handpick very selected groups of people who are they have the pure disorder, they don't have other conditions, psychiatric or medical conditions, and they're treated in a very high intensity, high pressure kind of setting in which there's the least chance of bad things happening. Then once a drug is released to the general public, you have what's called effectiveness. We were studying efficacy before, now you're studying the effectiveness in large populations. These are people, many of them, who would never have been approved to get into a study. They have other conditions in addition to their depression or PTSD.
I'm Ivan Rodriguez reporting.
Now, the American Psychiatric Association says it welcomes federal investment into research into psychedelic therapies as treatment options for serious mental illnesses. The organization added they do have concern about fast-tracking FDA approvals, though. Coming up after the break, we'll take you to a nonprofit that works with veterans after they're home from service. The story behind Mission Phoenix and how they are supporting our service members.
Ten News on WBIR starts now.
Welcome back. One East Tennessee nonprofit is focused on supporting veterans after they return home. Mission Phoenix works with veterans experiencing post-traumatic stress through counseling, training programs, and community education. Founder Josh Gagnier says many veterans return home and deal with flashbacks, nightmares, and other effects of trauma, which impacts their daily lives. He says one of the organization's main goals is helping people better understand what those veterans may be going through to avoid potentially harmful situations.
A lot of times people have not recognized it as an actual wound, but it does redesign the brain. It does change the structure of the brain, causing the veteran to not be able to understand what's going on in those situations.
Mission Phoenix is also pushing to normalize its Invictus invitation symbol, an identifier created for veterans living with PTSD. The organization says the symbol is meant to help law enforcement, first responders, and community members recognize when a veteran may be experiencing trauma and allow them to de-escalate the situation.
It's an identifier that we developed, a trademark identifier that can only be worn by a veteran that has post-traumatic stress. And what this does is it allows, like law enforcement, it's similar to the autism symbol. When officers see the autism symbol, they recognize that there's an autistic child, a person in the car, and they basically change their direction on how they're going to pursue that.
Mission Phoenix says its programs are designed to help veterans find support, access resources, and build stronger connections with the communities they served to protect. And if you've learned anything today, it's that nobody is truly alone. But it's easy to feel isolated if you don't feel understood by the mental health professionals who are trying to help you. Emily Crabtree spoke with one therapist who explains why representation matters when choosing a therapist.
Talking with a therapist can be a very vulnerable experience, and finding someone you relate to is an important piece in that puzzle. But for some communities, that can be more of a challenge.
A lot of clients I get from, referrals from other therapists or from schools, the individuals, they had no idea there was Black therapists.
But Dr. Julius Jeffries says the issue isn't a lack of therapists.
Here in Knoxville, I don't think it's lack of diversity. I think it's lack of opportunity. And I think it's lack of putting it out there that, therapists are needed.
He says for many of his clients, it's a surprise to see a therapist who can relate to them.
My teenage clients, they're always like, we didn't even know there was a Black therapist, or even a Black male therapist, no less. If you even break it down further, there's not a lot of male therapists historically because of the stigma about males talking about feelings and emotions and that being viewed as a vulnerability or weakness.
Jeffries says it's important for people to see that there are therapists out there who come from similar walks of life and can understand what they may be going through.
Representation matters because someone can say, well, you look like me, or you have that lived experience. You can be educated and trained to serve other communities. That is fact, but also there's a lot to be said about somebody who has gone through a similar walk of life.
But what can you do if you aren't in a position to afford therapy? Census data from 2023 shows us almost 10% of Tennesseans don't have insurance and 30% are classified as ALICE patients. ALICE stands for Asset Limited Income Constrained and Employed, meaning those patients are above the poverty level but still cannot afford the basic cost of living. These households may have insurance, but the coverage may be limited or copays are too high. Here in East Tennessee, one organization is dedicated to helping everyone get care. The Mental Health Association of East Tennessee has a treatment and access bank, helping people with financial challenges get quality mental health care. The Treatment Access Bank will cover most of the cost, with patients paying between $5 to $10 each session. It helps clients who have low household income or are uninsured or underinsured or are unable to afford therapy. To qualify, you must be experiencing one of those barriers, at least 16 years old, and live within the Mental Health Association of East Tennessee's service area, which covers a majority of the counties in our area. The bank will cover 15 sessions per client. Another organization is also helping people in need. The Behavioral Safety Net at the McNabb Center is a state-funded program providing outpatient mental health services to those without insurance. Shannon Dow, a therapist at the McNabb Center in Blount County, says this program is one she's most proud of.
Behavioral Health Safety Net allows us to provide essential mental health services to, like I said, children and adults who otherwise likely would not have access to mental health care because of a lack of insurance or insurance not covering those essential behavioral health services.
The nonprofit says they provide mental health services as well as support for those battling addiction and social services. The organization helps more than 51,000 people throughout East Tennessee every year across 27 counties. And if you're watching this right now, you probably watch the news quite a bit. And it's easy to feel the weight of the world on your shoulders. Emily Crabtree talked with one therapist who is giving tips on how to manage stress caused by global events.
Of course, like, we want to be informed, but also that increases our stress. And so then on top of, economic issues, on top of in-house social issues, now we have a war going on and everyone's wondering, like, how is it going to end?
In the age of social media, getting your top headlines is always just one click away. But for some people, that ease of access can cause more harm than good.
A lot of my clients have been feeling just really overwhelmed and also powerless.
For people who struggle with their mental health, constant news cycles can add stress to their day-to-day life.
And a lot of times that can be very overwhelming, like just thinking about all of that loss of life, all of that, fighting, and then you pull up to the gas station and you're paying $50 or $60. It's kind of like stress all around.
Dr. Julius Jeffries says he reminds his clients to find things that ground them. That way they can focus on their personal life.
Putting yourself in the best place physically and mentally helps you deal with stress better, especially if it's stress that you can't rightly control. Like, other than advocating and being a support system for those who serve, we can't really do anything for wars or in other countries.
Dr. Jeffries recommends reaching out to a therapist or just taking some time off of social media.
It's okay to take a break from being informed. Yes, you want to be informed about a war when it's definitely affecting economic things and things here in the United States, but also the human mind was not conditioned to take nonstop stress and bombardment, and we've all been underneath that now for years.
While too much technology can hurt your mental health, some say social media has played a positive role in the mental health conversation, though. Ben Harrington from the Mental Health Association of East Tennessee says people, specifically younger generations, are discussing their mental health struggles more openly than ever before. He said it's helping normalize mental illness and helping people get the resources they need.
Social media is very much a comfort zone, and younger people are more willing to talk about this. It became a thing. You could talk about it. You could talk about mental health in the workplace. You could talk about what should an employer be doing in the workplace to better support their employees, right?
He says since the pandemic, everyone is more aware of the importance of mental health. You can see this through more employers offering mental health days or providing extra resources to their employees as well. Still to come, Anderson County's school district is putting together a team helping students take care of their mental health, how these efforts are making a difference, and why school leaders say it's breaking barriers next.
10 News on WBIR starts now.
Welcome back. One school district in East Tennessee is making sure their students' mental health is taken care of. Emily Crabtree spoke with Anderson County School District's mental health therapy team to learn more.
Anderson County Schools' motto is every student, every day. They say that includes taking care of their students' mental health.
What we try to do is offer the same level of care and quality that any student would receive if they sought therapy out in the community.
The mental health therapist team with ACS has 4 dedicated, fully licensed therapists to help provide quality care for students throughout their school years. The team of therapists recognizes that there are barriers for some students to receive care, so this program aims to make therapy more accessible.
A lot of parents will have a hard time accessing mental health care out in the community because maybe there are issues, barriers with transportation. Maybe there are barriers with insurance lapses, or they can't afford co-pays, things like that.
The therapist team says they have a smaller caseload than a typical school counselor would, so they're able to provide one-on-one care for a student for a longer period of time.
Sometimes spanning multiple years. We're following the kids as they move up from one grade or even one school to another one. And we can provide them dedicated mental health therapy for a longer period of time and for a much smaller caseload.
They say building that relationship with kids is incredibly important.
You can take the best student in the world, and if they've got too much going on at home, if they're worried about their relationships, their family, their friends, the world around them, that child's going to have a harder time learning.
The mental health therapy team says parents can refer their students to the therapy team through their child's school. And if you or a loved one is struggling with their mental health, then you can call or text 988 to reach the Suicide and Crisis Lifeline. You can also chat with the provider online at 9888lifeline.org. Well, thanks so much for watching our mental health special. 10 News at 6 starts next.